My name is Monica Turinici. I'm in a PhD program in health management at Paris Cité University. And today I will present you a paper about sources of physician vulnerability to AI. So some words of this research. This research stems from the observation of the promises made by artificial intelligence to improve risk management in healthcare while fostering innovation and simplifying diagnostic processes. The promise of speed, standardization, increased confidence, prediction capability, and ultimately making the health system less vulnerable are among the expectations surrounding AI algorithms. Recently, several studies have highlighted the potential effects of artificial intelligence on the delivery of healthcare. AI-based tool can theoretically improve prognosis, diagnostics, and care planning. It is believed that AI will become an integral part of healthcare services and will be incorporated at several levels of clinical care. Doctor and patient could be the main beneficiary of this innovation, but perception of vulnerability may affect the widespread use of AI in health. So this paper represents a qualitative study of 20 doctor questioned about their reaction and perception regarding the use of AI algorithm as a diagnostic aids tool. So our primary objective was to explore the sources and the determinants of vulnerability among healthcare providers in the context of increasing AI integration. Why are we interested in the adoption of AI in the medical system? Because the strategy of algorithmized healthcare represents a major challenges in terms of profitability and competitiveness. Also, there are a lot of reflection on the risk of AI and the consideration of physician vulnerability. What there's the primary research questions for me are linked to the difficulty or the challenges in the adoption of AI in the healthcare sectors. So are the physician vulnerability potential barriers to the adoption of AI? And what are the sources of physician vulnerability to AI? What is the impact of AI on the doctor-patient relationship? Like I said, this is a qualitative study based on semi-structured interview, and the data from the study was conducted between November 22 and March 23. So it was before ChatGPT. Before presenting the main finding of the study, I will share some insights into the conceptualization of vulnerability. What is the vulnerability? So we reviewed extensive literature to better understand the notion of vulnerability. In the medical fields, vulnerability is understood as the result of several risk factors. The greater the exposure to medical economic risk, the higher the vulnerability. In medicine, when we talk about vulnerability, we often refer to specific categories of vulnerable population, such as pregnant women, mental health patients, chronic disease patients. And more recently, the discussion has also expanded to include a lack of decision-making autonomy among physicians. In the marketing and managerial fields, the vulnerability is understood as a state of powerlessness related to multiple sources of experience, and also as a loss of control. In the philosophical and ethical fields, the vulnerability is as a lack of personal autonomy. So what are the source and determinants of vulnerability? We identify three types of source in the decision-making imbalance induced by artificial intelligence, the perceptual determinants, and the data-related issue or datafication. So for the first type of sources of vulnerability induced by decision-making imbalances, we observe these imbalances between in the physician-patient interaction, also in diagnostic decision-making, and also the imbalances are specific. Some imbalances are specific to algorithms. In the physician-patient interaction, we can observe a lot of deshumanization of the relationship, also the threats to autonomy, authority, and expertise, a loss of meaning in the medical examination, a loss of flexibility, or a hyper-standardization of protocols by AI. So I can illustrate this with some verbatims from some medical doctors' interview. A doctor tells us that a human being in contact with another human being begins to co-create something that is healing, and that's quite exceptional in the interhuman relationship. The danger with AI is that it may make all of this disappear or significantly undermine this relational aspects. Another medical doctor tells us that he thinks that AI is a real risk because we are entering into an ultra standardized protocol that already exists today, but due to the caregiver-patient relationship, this protocol are applied with more flexibility. It's true that if we start applying them in a strict, rigid way through machines, we lose that aspect, the elasticity and the flexibility. Today, we sometimes bypass protocols, we humanize the protocols, and we consider the particularity of each situation. So that's the risk, that we end up with something very reductive that does not account for the complexity of the human person. For the second source of vulnerability induced by decision-making imbalance, in the diagnostic decision-making this time, we observe the difficulty in addressing singularity and trust due to AI determinism, a lot of controversy also, and a lack of responsibility. The AI risk complicated our works, tell us some medical doctors, because we will be faced with an infinite number of possibilities. There is an overwhelming amount of recruitment in lung nodule screening. We end up spending more time rejecting nodules than accepting them. Another medical doctors tell us that this can be useful, AI can be useful, but if you use it in an emergency or in a severe case, you risk a misdiagnosis because you might miss the correct diagnosis. The body has for now been reduced to that data, and we decide on a diagnosis without even seeing it. It's a form of medical myopia. Another medical doctor tells us that the risk is moving from the doctor to machines, leading to a lack of responsibility or even no responsibility at all. So for the third source of vulnerability induced by decision-making imbalance, specific to algorithms this time, we observe a lack of interoperability between algorithms, the technical biases and the biological biases, and a limited of creativity. The second source of vulnerability is driven by perception. The perception can be cognitive, emotional, or ethical and social. For the cognitive, there is a rationalization regarding the risk of and limitation of AI. For the emotional perception, we observe a feeling of loss of control, a feeling of vulnerability between a physician, and a duality between distrust and trust. For the ethical perception, there is an overlooking survival chance and a potential discrimination. For the third sources of vulnerability is data related, and it's concerned the challenges in data access, the consent, and the confidentiality. For the challenge in data access, we refer to restricted access for the medical doctors and the dependence of doctors to the IT services. Also, you observe a dominance of IT services in hospitals and the data ownership, public asset or commodity. For the consent, there is a lack of clarity and a patient disempowerment. So, what was about in this paper? I tried to explain the vulnerability of healthcare providers, and confronted with AI, and we identify three sources of vulnerability: imbalance induced by AI at multiple levels, perceptual determinants, and datafication of healthcare practices. But there is additional aspects, like vulnerability as a source of responsibility, like unilateral vulnerability, patient perceived as more vulnerable by doctors. Also generational vulnerability, senior more open to innovation, junior more comfortable with data handling, but less confident with AI, and so on. So what is the role of vulnerability in the responsible adoption of AI? For the relational and decisional vulnerability, we think that this kind of vulnerability can temporalize and slow down unrealistic promises of AI. Also raise awarenesses of the importance of the doctor-patient relationship in the healing process. For the algorithmic vulnerability, there is an emphasis of the needs for differentiated reflection on the potential use of AI. It's not the same thing when we use AI for diagnostic or prediction. For the perceptual vulnerability, we observe an increase the sense of responsibility toward patients, broaden the societal debate on AI adoption, and reconsider the evolving identity of doctor. For the data-related vulnerability, we observe and reinforce the discourse on the status of medical data within the context of algorithmization of healthcare practices. So we need to building a balanced management model of vulnerability in the context of healthcare algorithmization by promote dialogue between public and private sector, and within hospital, foster communication among physician, AI developers, and end users. Also, must create an environment where AI is perceived as a supportive diagnostic tool rather than a replacement for human expertise. We need to involve patients in the design of AI-mediated care pathway, and we need to keep the human element in the central to the care process by empathy, patient-doctor relationship, so on. So thank you very much for your attention. And
thank you very much, Dr. Turinici.